M&D Care are a specialist social care provider, providing bespoke residential, supported living and domiciliary care services to people with very complex needs. We have several services based across a large geographical location, supporting over 200 people, and we have over 400 staff supporting those individuals. We were looking for a software platform that would be adaptable and meet our needs, and Celo Health was exactly that, and it would help with the bespoke needs that we required. It would allowed us to have that two-way messaging that we really so desperately needed, and it would be instant and safe, which was sort of very important to us.
I struggle very much with new technology. When Celo was first introduced, I was very nervous. But I found Celo probably one of the easiest apps to navigate through. Everything is on there that you need to know, and it runs through step by step what you needed to do, which I found very, very helpful. All the information that we provide over to staff is confidential information. We need a secure app that's encrypted for us to be able to keep our information confidential so that it doesn't fall into the wrong hands if staff members to lose their phone.
So like with WhatsApp and texting, we don't really know where that information is shared, but with Celo, we know it's secure, it's encrypted, so we know all of our information is kept private and is secure. Documents to our staff and things, we know it will be safe. So we don't have to use people's phone numbers either. Some people like to keep that private, so it's good that we can use Celo because it's all over the internet then.
The broadcast function is extremely useful to us because it enables us to communicate instantly with all our employees across all locations, and we're able to sort of share with them vital sort of information, whether that be about policy or procedures or a change in any things that are going on within M&D Care, and we can share with them documents, pictures, images, all at the touch of a button, which is absolutely great.
So Celo is used every day. From the minute your shift starts to the minute that the shift ends. You know, within care, you're constantly handing over important information. Myself, I have a lot of communication groups for my staff team, one of these being a photos group. Within Celo, you've got that ability to not save to your phone, so that's something that is really important. The last thing I would want is for staff to have these photos on their personal devices, so to have that library on Celo where those photos can be stored as well is perfect.
It allows us to have a bit more of a bond with the team because we can personally message each member of the team as well as have them in a group chat. Staff can come to us with their concerns, and maybe they don't always want to come into the office because it's a bit awkward speaking face to face, but Celo's enabled them to still have that secure, safe place to speak to us without having to be face to face.
Celo has been a great communication system for us. We find it far better than anything we've previously used. We rely quite heavily on Celo, and I think without Celo in our day-to-day working, it wouldn't be as effective as it was now.
Here at M&D Care, we use a term that the Celo effect, because everybody is using it, and it's something that everybody has sort of adapted to really quickly and engaged with excellently. And I think it's definitely that Celo effect that is rippling throughout our organisation and having a really positive impact on how we use it within our working practices, and we wouldn't be without it now.